just flex your hip. Okay, on this machine, you can go a little bit heavier as you get stronger. Right? What I also like about it is because remember I was talking about the rotation component, the multifidi. Well, as this pushes you down, it wants to rotate you. As you pull on this, it wants to rotate you. So your body has to resist some of that rotation. You're doing it with your hands because you're stabilized here, but you can feel it in your trunk and in your torso, which is good for your lower back. You'll find a lot of clients or a lot of people have lower back pain. They're weak in this transverse plane of motion. Okay, so you want to challenge this rotational component. Okay. Okay, the adductor machine. Your adductors also attach to your pelvis, so you definitely want to work your adductors as well. Now, you work your adductors when you do a squat or do a lunge or you ride a bike or anytime you're extending your hip or bringing back your legs from hip flexion, you're working your adductors. So the important thing is that there's an axis down here. See this axis? It's supposed to run through my hip. For a lot of people, you need to really sit forward on this seat. See the space between my seat? So the axis lines up nicely. Okay, be careful, guys. If you're going to do this, be careful. The first rep that you do this, if you haven't done this before, you might strain that muscle. So I usually, for the first rep, push in with my hands, grab it, and then eccentrically unload it, decelerate it, and then bring it in and out. Okay? Depending on the girth of the person back here is where you're going to line up the head to the axis. Okay? Okay, I'm standing at a free motion cable cross, and I got it up at a kind of a high pull. What I'm doing here, I'm doing it again one-handed because of the rotational component. As I pull on it, it's pulling on me. Right, so it wants to rotate me. Remember, your latissimus dorsi attaches to your spine. And through the thoracolumbar fascia, it communicates to this glute. So it would be nice to work the glute and the lat at the same time. Now you could do that by extending your hip and pulling. So, or you could just shorten your glute, right? So turn, so you're firing your glute, and then pull, right? Feels a little odd that way. So right now I'm just thinking about the latissimus dorsi, right? And the rotational component of tighten my abs. Okay, and I can move this at different levels. Can rotate, pull from here. Pull from here in the sagittal plane or in the transverse plane. Now be careful if you do it this way that you don't end up doing a lot of elbow motion. This is just elbow motion. You're really not moving your shoulder as much as this. See when I end up in a right angle here? Okay, now when you do this, you're going to feel this in your core and you're going to feel this in your glute. Okay? You can keep going. You can go all the way to the ground, but just remember this. If you get to the ground and you start to pull up, upper trapezius is going to work. So if you have any tightness in the upper trapezius, you hold stress in your neck here, then anything below level to ground, anything below that, the upper fibers are going to work. So I usually stay from parallel to the ground up and just pull. Right? And you can do the same thing with your chest. And what we're doing is we're working the core, but using our extremity, one extremity at a time, so that there's a rotational component. So whether you want to fly or press, either way, this is trying to rotate me back. So my body, my core, has to rotate me the other way. Okay? And you can do this at different degrees. This is not a bodybuilding exercise. It's not a strength building exercise. Well, it is, but we're trying to work the core by using our extremities as a lever so that this pulley can pull us into rotation or oppose the lat or the chest or the pec, whatever we're working. Okay? Okay, same thing. Use one dumbbell. So now obviously you could do bent over rows, drawing, keep your back straight, right? And just do one arm bent over rows because it's rotating you. You can lift one leg, opposite leg, it doesn't matter. Anything you do, presses, just be careful. If you're adding weight to your skeletal system in an upright position, so if you have any disc problem or some kind of stenosis, then this could cause a problem because you're putting force through your body. Okay? Just like I forgot to mention, we were doing the VKR and we were lifting our leg back and forth. If you got a spondylolisthesis somewhere in your L5, S1 or somewhere, there might be instability in that plane. You might hear some clicking. That might be contraindicated. You could slow it down on the VKR and find ranges of motion where that thing doesn't click. So again, whether you're doing a curl or whatever you might be doing, do it one-armed so that there's a rotational component in the lower spine. So if we work the glutes, the hamstrings, the hip flexors, the adductors, the lats, all of this attaches to the spine, or the thoracolumbar fascia, which is attached to the spine. Work the abdominals. These kind of exercises will help strengthen the musculature around your lower back, help support your lower back, which will hopefully alleviate the pain. Okay? I hope that helps. Any more questions? Call me at 1-800-778-6060, or just go to nccpt.com.